Yeah, Ian Lees-Galloway, great speech. I want to begin by echoing the comments made both by Paul Hutchison and Ruth Dyson, and that indeed I made at the second reading speech, praising the other members of the Select Committee for their work, and also the officials and the submitters. It was a great experience to be part of. It was a shame, I think, Sir, that the Minister in his speech to open this debate couldn't resist the temptation to talk about what he sees as the achievements of this government in the health sector, because inevitably that opens up the territory to those of us like myself who see this government's achievements in health as being particularly negative ones. So, for example, I need to respond to the Minister's comments by pointing out that in its two budgets so far, this government has slashed funding for health services in real terms. In this year's budget, we're at least $150 million down on what's required for the health sector to tread water in real terms, sir. And that's being measured right across the sector, and services that are being cut or are struggling now to maintain parity with the task that's been set for them. So we've also seen a government that has whittled away the targets that the health sector has and focused those targets on particular areas of performance. So we had Paul Hutchison talking, for example, as the Minister did, about increased elective surgery. Well, that's because elective surgery is one of the few targets that are left in the health sector. So that's the thing that the sector chooses to focus on rather than everything else. Now, as it happens, sir, elective surgery makes up about 5% of what we ask the health sector to do. And if you ask most of the experts in health, it's the least important 5%. And actually that's occurring at the expense of the most important aspects of the health sector in public health and in primary care. So we haven't seen from this government any kind of coherent plan for dealing with the crisis in rural and provincial health services. And indeed, just last week, we heard, it was 2 weeks ago, we heard from Murray Horn, who chairs the National Health Board, that comments along the lines of when hospital services are centralised in Christchurch for West Coast people. Well, for West Coast people, that's an alarm bell, because it suggests that the government, in fact, has made a decision about the future of health services, and the future of rural hospital services is to be centralised in city hospitals. Certainly that's one of the options, but I think most rural people were hoping that the government would instead support the retention of hospital services in rural areas and have something sensible to say and do about the retention of primary care services in rural areas also. Sadly, no. It's early days yet, sir, but as yet we haven't seen any kind of coherent plan for dealing with the crisis in the health sector workforce. And certainly look forward to the Minister having something to say about that issue. We have, sir, a Ministry of Health that's currently in disarray and critical erosion of capability, largely as a result of the significant change that's occurring, leaving the ministry effectively in irons. Sir, I could go on, but I make these criticisms, sir, as I said, because the Minister himself opened up this territory. The area of collaboration is an important one, and it's one that the Green Party has advocated strongly for, because collaboration between district health boards and between other entities in the health sector enables us to have a health sector and a health service that is able to respond in an intelligent way to the fact that some services need to be organised at very much a local level, while others require a regional or a national focus. And so the effect of this bill to enable better collaboration between entities in the health sector is a good one, and a far, far preferable alternative to restructuring the sector once again and forced mergers between district health boards and other entities, and so I don't need to say anything more about that. The Health Quality and Safety Commission, also a really important advance. Debates around this bill at earlier stages have highlighted the enormous potential to extract gains in the health sector from improving aspects of quality. So accessibility of services, the acceptability of those services, their effectiveness, their efficiency, and the safety of services. The potential for gain is very great indeed, sir. It will be important when the Commission comes to its work that it focuses right across the sector on all aspects, right through from public health at one end, those services intended to keep people well, through primary care, secondary care, tertiary and even quaternary services, sir, but also in disability support services and aged care services. It's also important that it deals not only with those aspects of health services that are about the interaction between individual clinicians and individual patients, but also that it reflects on and works to create improvements in system-wide effects, the systemic effect of the health services and the systemic situation of those people using health services. And Ian Lees-Galloway has referred to the effect of inequality in health, and that will have an important impact on the work that this Commission does. I want to thank both Paul Hutchison and Ruth Dyson for their kind remarks about the supplementary order paper that I brought to the House on this bill, and indeed congratulate the House and all of its parties, everyone represented here, for the unanimous support for the supplementary order paper. I think I probably don't need to go over the arguments that have been well rehearsed in the House. Save to say that had the self-funding model that originally appeared in the bill been allowed to stand, the consequence of that would have been perverse incentives that actually would have produced suboptimal outcomes and indeed hamstrung the Commission in its work. And I think it's to the House's credit that hasn't been allowed to stand, and that instead we have a rational and sensible basis for funding the service. I want to finish, sir, by referring to a couple of the next priorities. As Gareth Morgan has pointed out in his book, Health Check, some of the real outstanding priorities for the New Zealand health sector are firstly to massively increase the investment and focus of the sector on public health services, those services intended to keep people well in the first place and prevent illness and disability. Because, as Gareth Morgan points out, those services have far and away the best return on investment. The second thing that Gareth Morgan says that we should be doing is then leading a focused debate amongst New Zealand citizens around how we should make decisions about allocating the limited dollars and resources that are then available to the health sector. And so on the first of those priorities, we have a government that currently is moving in the wrong direction, taking money away from public health and putting it into the more specialised end of services. That is absolutely wrong. And on the second of those, we're still waiting to hear from the Minister about the progress that's been made in reforming the National Health Committee and the Public Health Advisory Committee to actually undertake precisely that task that Gareth Morgan suggests is important, to actually start that national conversation about how we best prioritise scarce health resources. This bill is an important start, sir, but we now need to move on to the really important work that lies before us. Thank you, sir.
Call the Honourable Heather Roy.
Thank you very much.